Hi, my name is Darcy, and I work with quality management. I was the team lead for RPIW 19, along with my 6 colleagues. I'll speak to a time of 20 minutes, divided between each of them. Picture of our group. We just named ourselves the Selfies, connected to the notion of a self-management plan for chronic disease plans grown. Yes. So our RPIW took place in the primary health care in Shellbrook, the Shellbrook Clinic, around the chronic disease management program. The increasing the capacity for the RN CDM to provide self-management support for her clients was a key goal for us. We see 81 patients in the chronic disease program. We know that there are many more patients out there with chronic disease who are not in the program, so it's not a statement of true demand, but that's the program number as it stands now. The provincial goal around chronic disease is that 80% of chronic disease clients should be managed according to chronic disease guidelines and their provincial templates associated with that program. We focused our attention on clients managing diabetes and coronary artery disease, primarily because it forms the bulk of their patient load. Other current situations included, if you just go back, included some lack of standard work and the complexity around coordinating services between different providers, not just the nurse, but the physician and respiratory therapy, educators, and so on. So some key metrics that we were interested in focusing on would be that clients walk out of their appointment with a written self-management plan. So clients have to be seen, should be seen every 3 months regularly to be managed according to these guidelines. And so any wastage in terms of lead time in getting clients rebooked efficiently and reliably makes them fall behind in their self-management plan. Having them walk out with the right written material is a key goal for every single client. Now, it wasn't being provided prior to the RPIW. The appointment booking process with the MOA was a key effect, that decreasing that lead time. Several bookings were taking up to a week plus to fill, so we wanted to push that lead time down. And also focusing on the exam room in which chronic disease clients were being seen. 5S in that room and turning it into a genuine exam room, not a half storage room, was a priority.
Hello, my name is Doug Dahl. I'm the sub-team lead for this RPIW. Walk you through a few value streams. Our most important one, of course, is around the patient, and this is the patient appointment process and what happens with the patient when they come for their appointment. We've identified a few starbursts. A couple of the key ones are around the self-management plan. But in addition to that value stream, we had to look at a couple of other processes that feed into it. One is what is happening with the chronic disease management RN around that program and the different things that impact her ability to provide self-management and make it an efficient appointment process. We've got a number of things in there about interruptions, IT issues, as well as a few other things about where they're located within the clinic. The next one is around the patient appointment scheduling process. Because there's been one person who's been doing this as part or a piece of a job that's sort of off the side of their desk around making the appointments and scheduling, our wait time for an appointment was, from when it should have been scheduled to when it was actually scheduled, was over a week. So we've identified a number of things that were problems with that, including cross-training and some standard work. This is our pre-Kaizen waste wheel. A lot of different things were identified prior to the event. And this is our TAC time. We have a TAC time of 185 minutes for patients' appointments going through the program. One of our challenges in creating TAC time for this event was that the RN in this position is doing more than the chronic disease management work. After observations and timings and working through what she was doing, she was maybe spending only about half her time specifically with people in the program. So we with available time. So our TAC time ended up being at 185 minutes to get those 81 people through every 3 months. Again, it doesn't take into that demand some of the other work that goes with it.
Hello, my name is Lisa Herodens, and I was a participant in this RPIW, and when I wasn't, next week I returned to my regional director of therapy position. So you'll see before you, this is the pre-5S score sheet, and we had a score of 1.1 going into it. And one of the things that I just want to mention about the 5S that went on in this work, the primary healthcare clinic in Shellbrook is a leased space, and so we had to be very mindful of that when we were looking at what we could do to change the space physically, so pulling up cupboards and so on really couldn't happen. The other thing was that it was a private doctor's office prior to becoming the primary healthcare clinic as well, so there were many items that we found in the cupboards that had been left behind by doctors when left. So coming forward to the pictures that we're going to see, this is we actually 5S 2 spaces, the lab, what they called the lab room, which was really a catch-all multi-purpose room for staff and for patients to come in. And then the exam room, which Doug mentioned, was used for the chronic disease management nurse to see her patients for those chronic diseases that they were coming in for. So there's lots of things happening in this room. There wasn't stuff right at the fingertips, but there were some OH&S issues that we will also, you'll see the baby scale and the dirty laundry sitting quite close together, but above the baby scale, that window was, on the other side was the patient washroom where the specimens, urine specimens would come through. So a little bit of we could improve upon that. So the next, this is the exam room, and what we found here, this was happening, you can't tell from this picture, but the printer was at my head. So to get up into those cupboards for their supplies, their gloves, their needles, you had to get onto the table, and cleaning those out was a bit of a challenge. They're very deep cupboards. So those will be addressed as we go forward. So coming to our post-5S score, we had a score of 3.5, so we were very, very happy about that. And going to the pictures, post-5S, we now see the lab room, which looks much better. The baby scale has been moved. There's a proper dirty linen cart, which that's what we were able to get at this point. A proper garbage can, and it's been removed. Those have been removed from underneath the specimen window. And we actually ran into, for the OHS, we actually moved the needles into a different area as well, because again, those were not in a safe place even after we posted 5S. We got feedback, and we very quickly moved those to a much safer area. So the next picture just shows us those cupboards have been completely empty, and will, with the owner of the building, come down hopefully near future. And then we moved some of the sundries, paper towel Kleenex into a storage room, and were labeled with the stock numbers ordered, so it's quickly for the staff to reorder the MOAs. And then just a couple items we found. That was the old centrifuge under the exam room. That didn't even go to third world. and back in the days when some of the private physicians did ear piercing for future service, we found one of those. So thank you.
Hi, my name is Tara, and I'm one of the medical office assistants at the Shellbrook Primary Health Clinic. I'm one of many individuals involved in our chronic disease management program, and we found that there was no set time to dedicate the needed time and focus into making sure that our chronic disease management patients were being booked in a timely and efficient manner. It was a problem because only myself at the time was familiar with this and how to book patients and what was needed. Some of the ideas that we came up with were to create dedicated time, certain time every day, so that someone can disengage from clinic duties, from the clinic to book chronic disease management appointments, and also to review upcoming chronic disease management appointments, because even though patients are scheduled, sometimes they forget to go for their labs, and then it's kind of like a wasted appointment. So And the next was to create a standard of work on how to book a chronic disease management appointment and the training of the other medical office assistants so that anyone can book them. The results were that the other medical office assistants felt more confident and empowered to actually book these chronic disease management appointments. Appointments are also going to be booked on a daily basis on the day that they come up, and if I'm away, patients won't have to wait till I get back for their appointments to be booked. We have made up and trained 83% of our medical office assistants on the standard of work for booking the chronic disease management appointment, which will also help for our future new hires and training. A multi-skills training sheet has been done, and we are already started on doing up more standards of work for other areas of our clinic, which we hope to complete in the near future.
Hi, I'm Chris. I'm a representative as a patient. I'm from LASK, and I'm my dad's support system. I was a part of helping these people look at the self-management plan and see if it was user-friendly as a patient. And some of the things that we talked about, that we recognized that on their first visit, not every patient is going to be ready to leave with that plan. Also to recognize that our clients have a wide variety of literacy levels. We need to be very cognizant of that. In developing this plan, this is the plan here. It's simple, it's understandable for the patient, and it's very important, I think, as a patient to leave with something that helps keep you on track, because so many patients leave and can't remember what their clinician spoke to them about. Also to create some efficiencies, we made sure that the printer was available and set up a proper work table for the RN to be able to work more efficiently.
Thank you. I'm Connie Lee. I was RPIW participant and Regional Director of Primary Health Care. So certainly what we found is that the chronic care program has made significant inroads to date around providing consistency of care, because we have a very mobile clinician workforce, and providing a touch point for clients so that they can call the clinic and get some support even though they're not able to get an appointment necessarily. So through the face-to-face and phone contact that the CDRN currently, CDB in chronic disease, RN, currently provides, she does provide self-management and self-care. The challenge, however, is that clients weren't leaving with a care plan that they could use on a day-to-day basis or as a tool to track their progress or track their concerns when they came back for their next visit. So we had a number of ideas that we came up with. You'll see the idea sheet there, the first one. And the intent was to understand how time was being used within the existing CDM appointment. So a pre-Kaizen percent load chart was completed to better understand how that time was being utilized. One of our second ideas was updating and refining the patient self-management plan, like you heard from Chris, so that the self-management plan was easier to complete during the clinic appointment. It had a better flow with the existing CDM forms that we already are required to complete. And thirdly, one of our third ideas was ensuring that the required information for the clinic visit was in fact pre-populated into the electronic medical record before the appointment, which included a complete history. And the last idea around this particular piece was understanding, what we still need to do is understand the actual demand for chronic care within the population base at Shellbrook. So what we found was that the CDM program currently spends about 50% of its time with patient care appointments or CDM appointments, and the other 50% is with client support activities. So the improvement action, we implemented the client self-management plan and utilized the time observation chart that you'll see there, created a work standard, and implemented some training. As we have one staff member that does this, the training was pretty straightforward to track the improvement that we made. So with the RPIW, we were able to track 2 appointments and the use of the CDM self-management tool. Now, secondary to the small sample size that we had the work standard combination sheet and the percent load chart that was post-Kaizen did not show any change at this point because of our small sample size. Thank you.
Hi, I'm Brett Enns, and I'm the Regional Director of Mental Health Addictions and Acquired Brain Injury, and I was a participant in RPIW. So in talking with Lori, our CDM nurse, we followed her around and just got some ideas about, okay, what's the process about it, how can we help her with that? And so a couple of the things that came up was interruptions, and specifically interruptions when she went to prep the room. And so what we did was we were able to identify one room, made it the CDSM room, and she was able to keep all of her supplies in that room and work from that room. The second idea that came about was, so when she went to chart, she had to go back to a general room that was interdisciplinary clinicians. And often on the way, she would get stopped or interrupted, or even when she was there, she would get stopped and interrupted in the charting. So we did two things. First of all, like Chris mentioned, we created a table space for her right in the exam room where she could put file and such to work from. The other piece was that we lengthened the time of the actual appointment, so she could actually chart after the appointment with the client, the face-to-face portion of it. So that was it. And then the third thing that we found out was that there was an automated telephone system, and in that automated telephone system, folks had the option to press number 2, which would make a direct call to her. Well, sometimes it was about CDSM, but often it was about, I'd like to cancel my appointment, or I'd like to reschedule. So we found that that kind of interaction wasn't really helping her at all. So we redirected that to the MOAs, and as such now the MOAs will screen all of those calls. So in following her around in pre-Kaizen, we found her to make about 347 steps in the process of bringing somebody in and rooming them, preparing and all that. Post-Kaizen, we found that we were able to reduce that to 157 steps. So, I mean, I'm not a math guy, but what it told us was that it was a 46% reduction.
Thank you, Brett. So we're going to take a look at the value stream maps and identify some of the areas where we made improvements. Obviously, from the patient perspective, the most important thing is they're leaving their appointment with a written self-management plan, something that they can use to follow, and we'll be doing that with patients going forward. Around the patient appointment scheduling, all of the cross-training and standard work for all of the MOAs, so things don't get left, things don't get batched. A lot of that will block off a number of those things and help us get the bookings done on a more timely fashion. And then for the RN, again, we help develop that plan. It's user-friendly for the nurse as well as the patient, and we've done a lot of things to reduce interruptions. We have a few items open on our newspaper. A few of them are around some training, a number of them are around some things around maintenance, getting those shelves out of the way. There's a couple of IT issues that still remain in terms of being able to free up some time if some information technology solutions are created. Our final target progress report, just a few things to highlight. Of course, under defects, the quality, everybody is leaving with an offer of written self-care plans. We are getting the bookings done on a timely fashion. Productivity, it seems to have created a little bit more time for the nurse to make some calls outside of the appointment process to follow up with people who are chronic disease management program patients. And we made the exam room an exam room, not a storage room, an exam room. We cleared a number of things off of our waste wheel. We still have a few that were left to be identified and corrected. And Darcy.
Thank you. So just a few key learnings. In summary, communication, it's been said before, and will be again, is essential. Not just asking questions and informing, but a lot of follow-up, a lot of clarification, and it's a lesson learned at every event. Taking great care not to center on the individual. In this case, it was one RN primarily that we had invaded for the week, so we had to take a lot of care that this is what the process and what the goal and not about the person. It was the clinic's baptism into RPIW and lean. So with people with basic introduction to Kaizen and lean, there were a lot of opportunities to teach. So take those opportunities whenever they come up. Extra explanation, engaging staff above and beyond to try to take those moments. Arriving at shared understanding about definitions, not to assume that we understand the operations. We made some initial, the picture going into an event, and you have to talk your way through that to get to that. And then roles in space, just a lesson that when the region defines its, designs its roles and some of its workspaces, that it happened by intention, not by accident. So something as it can. I'd like to thank some of the support teams that were very quick and responsive and fixed things as they came up throughout the month. The IT team, materials management, still processing, with KPO Ian and John Black, the management team, and the staff in general at the clinic, extremely open and positive, that you let us follow and ask as many questions, and it really is a good groundwork that I think the future events here will be successful because of the staff you have. Our own team, and especially our patient team member, thank you very much, Chris, for your voice also, for a very successful event.